My name is Elizabeth Sharp. I'm with the Children's Bureau. I'm from the Policy Division. And I am going to talk to you today very briefly about the Fostering Connections to Success and Increasing Adoptions Act of 2008, which I'm sure you have all heard of and you're all ready to hear a lot more about. First off, I'm not going to be taking questions today, but don't be too disappointed. I know I'm not. You're going to get a whole lot of information really soon. There's actually going to be information coming from us. There's things in clearance right now. You're going to be getting an IM very soon. There's also going to be a compilation of the Social Security Act, which is going to show you exactly how this law has affected the current law. Please do write down your questions, though. They're really important to us, and send them on to your regional offices because we do want to get those. We want those to be dealt with, and we are interested in what you have to say and what thoughts you might have about the effect of this law. Now, I'm just going to tell you, too, right now that this is a summary of a lot of the provisions. It doesn't hit every provision. It doesn't hit every little thing that's going to be affected by this law. And like I said, the additional guidance is forthcoming. Now, the first thing that the law does is extend and expand the Adoption Incentive Program. And that's going to extend the program as it is now through 2013, also updating the base year that's used to measure the increases to 2007. It's going to double the incentive payment amounts for special needs children from $2,000 to $4,000, and for older children adoptions from $4,000 to $8,000. It also creates a new highest ever foster child adoption rate payment. And that'll be paid out only after the special needs and older child adoption payments have been exhausted. If there's any money left over, then it will go to this higher ever foster adoption rate payment. And that's based on numbers starting in 2002. And that all goes into effect upon enactment, which was October 7th, 2008. It also creates an option to provide kinship guardianship payments under Title IV-E. This is optional. You have to opt into it, and there are certain requirements. For example, to be eligible for a kinship guardianship payment, a child must have been eligible for Title IV-E foster care maintenance payments while residing with the relative guardian who is going to take guardianship of them for at least 6 consecutive months. And also, if I'm talking too fast, just yell out at me. It also is going to create other requirements related to the program, background checks, child abuse and neglect checks. It creates categorical eligibility for Medicaid for these guardianship kids. And it's going to create sibling eligibility for kids who are placed with their siblings under the same guardianship arrangement. It also creates these family connection grants, and that's for kinship navigator programs, for efforts to find biological family using technology and reestablish those relationships, for family decision-making meetings, and for residential family treatment programs. The bill appropriates $15 million each year for this, with $5 million of that appropriated for just the kinship navigator programs. And let me go back for a minute and talk to you a little bit more about the guardianship piece. For states that have the guardianship demonstration projects ongoing right now, the kids in those projects who are receiving services as of September 30th, 2008 will retain the eligibility for guardianship services under the new program. But that's the cutoff date. All of this is going to become effective upon enactment, so it's already in place. And like I said, look for more guidance forthcoming about the program and what you would need to do. It also creates a state option to extend eligibility for Title IV-A payments up to age 21, so that states can opt from 19, 20, or 21. Those youth that are eligible under this are going to have to meet certain education, training, or work requirements, or have a medical reason they can't meet those requirements. And it would, it's going to become effective October 1st, 2010. It would also delink adoption assistance from AFDC income eligibility. And that's going to be phased in over time beginning in 2010. So it's going to start with kids who are 16 or older. They're going to be eligible to get this without having to look back to the AFDC eligibility, without any income eligibility. Every year, that age will decrease by 2 years for the eligibility. So in 2010, it's 16. In 2011, it's going to be 14, so on and so forth, until all kids of all ages would be eligible. And that age is at the time of the adoption assistance agreement being entered into. There's a few other exceptions. Siblings who are placed in the same adoption assistance agreement, they're going to be eligible under the new rules. Also, youth who have been in foster care for at least 60 consecutive months, so 5 years, all consecutive months within it, are going to be eligible under this right away. And there's also a new provision in this that's going to exclude children who were adopted outside the country and brought into the country, or who were brought into the country for the purpose of adoption and who are not citizens or residents from getting adoption assistance. And like I said, it's subject to phase-in starting October 1st, 2010. Yeah, sure, sorry. So a child who has special needs might be eligible otherwise, who is not a citizen or a resident of the United States, and they were either adopted in another country and then brought to the United States, or they were brought to the United States for the purposes of being adopted, are categorically ineligible for adoption assistance. Now, okay, sure.
Are you talking about all adoption assistance or including non-recurring costs?
I can't clarify that for you right now. That's going to be something that's going to be coming forthcoming in guidance. But you will get an answer to that, I promise. Okay, another big change is going to be a tribal option to operate a direct funded Title IV-E program. So federally recognized tribes, tribal organizations, and tribal consortia are going to be able to apply to receive foster care, adoption assistance funds, and at their option, just like a state option, kinship guardianship assistance. All Title IV-E requirements that are on states right now are going to apply equally to the tribes, except how is otherwise explained in the law. For example, for determining AFDC eligibility for foster care and guardianship payments, they're going to have to use the Title IV-A state plan, as was in effect July 16, 1996, of the state that the child resided in at the time of removal. Another piece, in-kind funding. Tribes are going to be able to use in-kind funding from third-party sources as match for some administrative and training costs. Some limits on that and some regulations that will have to be worked out, but that's another difference. Tribes don't have to apply for this. They can also apply to get CHAFE Foster Care Independence Program funding directly, and they can also negotiate to get a chunk of a state's allotment for CHAFE as well. Now, all of this is going to become effective October 1st, 2009. And I should also mention that there's some tribal technical assistance money. There are some monies to go towards supporting the Title IV-E plan development for the tribes. Now, some other changes. It's going to permit the agencies to claim the cost of short-term training for relative guardians, private child welfare agency staff who are providing services to Title IV-E children, to child abuse and neglect court personnel, to agency child or parent attorneys, to guardian ad litem, to court-appointed special advocates. And that's going to be phased in as well. It'll start out at a 55% rate of federal reimbursement and go up 5% until it reaches 75%, which will be the max. And that's effective upon enactment, so October 7th, 2008. It also adds several Title IV-E plan and case plan requirements that are effective upon enactment. Some of the 4E plan requirements include notice to relatives of removal requirements, school attendance assurances, sibling placement requirements, a requirement to inform parents of an adoption tax credit, and also a plan that permits the waiver of certain licensing requirements for relatives and for foster family licensing requirements. And there's also going to be a report to Congress required of us to do to keep track of whether waiving those requirements was helpful, which type of requirements were helpful, and the requirements that would be waived would be non-safety requirements. Some of the case plan requirements include a requirement for educational stability case plans and transition plans for emancipating youth. And all of those are effective upon enactment, but there are delays permitted for needed legislation for the Title IV-E plan requirements. As I said before, you're going to have to direct your questions to your regional office, let them know what you're thinking, and look for a lot of additional information and guidance coming from the Children's Bureau in the very near future, including that guidance is about to be issued any day now. Thank you.
Elizabeth, thank you. And remember, send your questions into the regional office. The Children's Bureau is very interested in your questions, your thoughts, and that really helps us and informs us as we're having discussions and figuring out what to issue as guidance. I can tell you from the moment that this law was enacted, and actually prior to its enactment, when we started hearing things, the policy division has been working tirelessly to put together an IM and direction for you. So, again, send your questions into the regional office. Now, I'm going to give you a real short federal update, and I can't remember the button I'm supposed to hit. Control.
You said spacebar.
Yay! All right. All right. I want to just give you a really brief federal, a federal update, but I want to talk about the training and technical assistance. You've just heard about a whole bunch of new things that have been enacted with this law. We're all dealing with a lot of child welfare issues. We've heard about some great things over the last couple of days. And what I want to say is, we know it's a tremendous challenge to implement all of these new things besides what you're already working on. And, it doesn't take a hurricane to get us to come in and help you with our Training and Technical Assistance Network. We're here to back you up. And every time we talk about our network, Heidi starts giving us the visual of the Verizon commercial. The state's out there, and we've got your back. The network is there. And we have been working very hard to really improve, to enhance, to take a look at how the network functions, and to, really create a group of providers that can come in and provide you individualized training and technical assistance and a wide variety of things that are available to you. And I want to talk to you about what we have and what we've just funded. We have the National Resource Centers, which I know you're all familiar with. Child Welfare Information Gateway. They know everything that there is to know about child welfare. It's at your fingertips. We have TA centers on mental health, substance abuse, Child Welfare Workforce Institute, Quality Improvement Centers, and I'm going to tell you a little bit more about the new implementation centers. Every year, the TNTA network meets regularly. We talk about what are our priorities, what does the field need, where can we really put some emphasis, and you're the first people to see this, including the network hasn't seen it yet, but we're looking at our priorities for 2009, always safety, permanency, and child well-being. We know that encompasses the work we do, but really looking at assessment and family engagement, substance abuse service array, youth permanency, tribal engagement, even more important with the new law, family connections, like we heard with the new law, data integration. Linda and Penny talked about that yesterday with that presentation. We heard from James Mason this morning about cultural competency, how important that is in terms of engaging families, working with individuals, workforce recruitment, retention, and really a focus on leadership, and then case review and court collaboration. Just very quickly, our National Resource Centers, obviously family-centered practice and permanency planning, NRC for youth development, at OU. Go Sooners! I don't know how they hire staff from OSU. I just don't get it. But okay, now we worked really hard to create a National Resource Center name that was longer than Family Center Practice and Permanency. I cannot tell you the number of meetings we had, and we did it. NRC for recruitment and retention of foster and adoptive families at Adopt Us Kids. All right. The NRC for organizational improvement. They're there to work with you about workforce, training, quality improvement, quality assurance, child welfare data and technology. You heard from them yesterday with Linda. The NRC for adoption. Natalie and her staff have done a great job putting our conference together. The NRC for legal and judicial issues. We have added this year 5 new centers that we call implementation centers. These centers aren't to take away work that's being done by the rest of the network, but to really be value added. And we did this in part because we were hearing from you, we were hearing from our whole TNTA network about the need to have additional supports when you were trying to implement strategies for change. And what we heard was oftentimes the National Resource Centers might be in there working with you around an initiative, but what we funded them to do is, working with you, develop strategies, look at models, but not to be there on the ground. And we didn't fund them to bring dollars to the table or resources to the table for the project to go to, to the end of the project. So this is, for us, a big idea. It's something we want to try out, a grand experiment, someone said. We have funded 5 of these, and rather than have them be national in scope like our National Resource Centers, their scope is to work within 2 regions and to actually provide for funding for projects within those regions over a time period. And you'll learn more about it. Kind of like the new law, more information is coming, especially the new names for them. One of the tasks we've given the new centers is to actually bring us some names that would describe what they are. So Center 1 will be Center something else in the end. But for Region 1 and 2, that's been awarded to the University of Southern Maine. Center 2, which is for Regions 3 and 4, is the University of Maryland at Baltimore, and they're partnering with ICF International. Center 3 is for Region 5 and 7, and that's at the University of Nebraska at Lincoln. And Center 4 is for Region 6 and 8, and that's at the University of Texas at Arlington, and they are partnering with the University of Denver, Butler Institute for Families, and the Native American Training Institute. And Center 5 is for Regions 9 and 10, and that was awarded to the American Institute for Research, AIR, and they are partnering with the Center for the Study of Social Policy, Georgetown University Technical Assistance Center for Children's Mental Health, University of Southern Florida, and the National Indian Child Welfare Association. These centers are to facilitate peer-to-peer mentoring and networking. They're to partner with states and tribes to implement change strategies. They're to provide long-term, in-depth TNTA in collaboration with our National Resource Centers that'll bring their topical expertise to the table. Okay. Now, the other thing we have just funded is really a complete redesign of our child welfare training grants. I don't know how many of you know that over the years we have funded child welfare training, BSW, MSW stipend programs. Each year we would have 30, 35, 40 small grants to universities to provide MSW, BSW stipends to students in the hopes that we would have them trained to work in child welfare. Well, over the years we have been trying to figure out a way to really enhance that effort and to connect it, not only all those grants together, but to connect it with the actual child welfare programs in states, as well as to our TNTA network. So what they learn in those grants is going to be fed right back into our network, and also is going to really, they're going to gain knowledge from working directly with state agencies. So First, we funded a National Child Welfare Workforce Institute at the Research Foundation of SUNY at the University of Albany, and they have a bunch of partners. The University of North Carolina at Chapel Hill, University of Denver, Butler Institute, Fordham, University of Iowa, Michigan State, University of Michigan, which is, I think, Go Blue, University of Southern Maine. Okay, their role is on the national level be to improve recruitment, retention, and training of child welfare professionals, promote a sustainable change in workforce practice, and national leadership training. And one component of this will be distance learning for supervisors. Doesn't that sound great? So your supervisors in your state will be able to access distance learning, and so we're real excited about that. They're going to coordinate the workforce networking. That institute is also going to be doing comprehensive child welfare workforce projects in local systems with the local agency, and that on a national level, they'll be providing some professional educational stipend programs for MSW and BSW students. Then we also funded 5 workforce projects with Colorado Seminary at the University of Denver, Louisiana State University, University of North Carolina at Chapel Hill, Research Foundation of SUNY at University of Albany, and your University of Kansas Center for Research. And these projects will be BSW, MSW programs, but as a component of that, they will also be working with public agencies in their states to assess what the workforce issues are and work with them about developing strategies for recruitment and retention of staff, child welfare staff in their agency. We've also funded 2 new quality improvement centers, one on preventing the abuse and neglect of infants and young children at the Center for the Study of Social Policy, and a National Quality Improvement Center on differential response with the American Humane Association. Then, diligent recruitment of families for children in foster care. We have funded 9 grants that were only eligible for states and counties. They are going to the Oklahoma Department of Human Services, Cuyahoga County in Ohio, Santa Cruz County in Santa Cruz, California, Maryland Department of Human Resources, the City and County of Denver, New York State, Missouri Department of Social Services, Kentucky Department of Community-Based Services, and Ramsey County, Minnesota. One of the things that we have started doing with some of our grants is funding them and then working with our national resource centers to actually help coordinate those grant clusters. And what that has given us is, in real time, the information that we're learning from these grants can be fed into the National Resource Center's resources, and you can gain access to it. I know that when I was a manager out in the field and I would hear about grants that were funded around, I remember a big push on post-adoption grants, but I really didn't have a way to access that information, and we've worked real closely with Child Welfare Information Gateway, so a lot of that information is available to you through that. But we've also created, with some of our grants, the ability for our National Resource Centers to actually work with the grantees to help them think about what's going on in the country, to inform them as they go through their grant years, but also whatever they produce can be fed out to the field. And I want to show you a great example of what the National Resource Center for Adoption has done in their work with a grantee cluster group on open adoption for youth. Thank you. I get the words all mixed up on that one. So, if you go to the Adoption NRC's website, there's a section that's got adoption opportunities grantees, and it can tell you about all the projects that were funded, background, what the projects are, and what they've produced. And this is so cool. So it lists who the grantees are. Then if you click on specific resources and tools and things that they've produced, it is so cool because then you can go down and, for instance, you can download this curriculum, this parenting curriculum trainer's guide, and I only have like the first 6 pages. It's 96 pages long, but you can download this and have access to it right now. in real time, you can get the resources that they've developed. So, we think this is a great use of not only to learn from our grantees as they're working, but to have that become a resource to you immediately. Isn't that cool? All right. Child Welfare Information Gateway, again, they know everything. They've got everything. Mary Sullivan has a dynamite group. It's dynamic. Go there if you've got questions. Also in your packet is the TNTA guide. You can pull this down off of Gateway. This is the 2008. In this, we have, I think, 21 agencies or organizations that are part of our TNTA network. Now we're going to have 25, and this is being updated as we speak. So you'll be able to figure out who's available to work with you, work with your regional offices, work with your Heidi and Patsy, if you're foster care adoption manager, Brian Deacons, around in-home services or family preservation, and we will connect you with whatever you need because, we got your back. Call us. We're available. The National Resource Centers, they're all available to help you. Now, I'm going to turn it over to Patsy, and she's going to take the next piece.
How do you do? I'm Patsy Buda. I'm the foster care manager for the Children's Bureau. It's a pleasure to see you all out here. I'm going to introduce Gary Mallon in just a moment, and he's going to be doing a session on affecting change, tools to use, which will be, and he'll facilitate that as we go forward into the afternoon. But before we get into this final session, I want to do one additional thing in kind of preparation. This final session we're going to be using to really give you an opportunity to strategize how you can use the tools you've heard about this week, how you can use the technical resource centers and the technical assistance through the Gateway to really make a change in your state. But because that is such an important task, I want to recognize somebody that I have known since 1990 that has really been effective in affecting change. Gail, would you raise your hand? Gail DeGouche is the foster care manager for New Hampshire. I had to recognize her today because she's been an inspiration to me since 1990 when I first met her. And I was also a brand new foster care manager without much knowledge about exactly what my job was. And she was doing a training to help do peer-to-peer training. And she has continued to help facilitate peer-to-peer knowledge across the nation, work with her state partners. I see in her a continuous passion for child welfare to really move forward programs that will help families and children, that will affect reunification, that will provide supports to families and children to keep children at home and to maintain children at home when they're reunified. She has worked with the different funding programs to make sure services are there. Gail's going to be retiring this year after 34 years in child welfare. And again, I'd like to just give her some acknowledgement and a round of applause for all the work that she's done. Thank you so much. Part of the reason I wanted to acknowledge Gail, she's not been the only inspiration to me. There's been so many other state program managers that we see out there really working hard at their job. And state program managers play a very critical role in bringing together the knowledge about best case practice and bringing it and developing new programs and thinking about those programs in a way that will include a training component, that will include a supervision component, that will include a quality assurance feedback loop so they know if the program is effective, to really think about how you can use data analysis so that you're evaluating your new programs and making sure that they are accomplishing the objectives for families and children that you're setting out to accomplish. So as we transition into thinking about how we can all make a difference, I'd like for us to think about our inspiration, think about those who have inspired us so that we can maintain that passion in our work. And I hope some of our new foster care and adoption managers will commit to stay in the field for as many years that Gail has so that they can make a continuous effort towards improvement. And then finally, I hope you will join with me in taking to your heart the sentiment that the foster adoptive parents shared with us this morning. It is the most worthwhile trouble I have ever put myself through. If you remember that there's a child, you will be surprised at the gifts that lie in you. So on that note, I'd like to introduce Gary Mallon, one of my other inspirations in life. He is a professor and executive director at the National Resource Center for Family-Centered Practice and Permanency Planning. Yes, I did come up with that name. At the Hunter College of Social Work in New York City. He's an adoptive parent, an author and editor of about 18 books or so. He's probably added some since this has been written, including Child Welfare of the 21st Century. Dr. Mallon has lectured extensively in the U.S., Ireland, Australia, Canada, and the United Kingdom. His career as a child welfare practitioner, advocate, and editor and researcher spans 31 years. And we have the pleasure of having him as the director of one of our national resource centers and having him facilitate us today.
I don't want my battery to die in the middle of this. Actually, that's an old thing. It's 33 years. I started as an 18-year-old in child welfare. I did, really. And as you were mentioning that about honoring Gail, who deserves to be honored because she's done great work in New Hampshire and is an inspiration for all of us, I was thinking about someone who was my inspiration when I was a young social worker, a woman named Rosemary Cristello at St. Agatha's Home in Nanuet, New York. And I remember Rosemary because she was one of those people who did things like teach you how to dress to go to court. Remember a good supervisor like that? Like wear a tie, wear a jacket. I remember her saying to me, "What are you wearing tomorrow?" And I said, "I'm going to kind of wear what I was wearing, which was jeans." And she said, "No, you're not. You're not going to embarrass our profession like that. You need to wear a tie and a jacket and real shoes." And I thought, wow. At the time, I didn't say wow. I said something else. But I realized later, as I passed on that advice to other people, how important it was to have somebody who was such a great leader like that in your life to form your professional development. And I remember she did another little thing, too. She used to carry around this steno book, and for many, many years until I transferred to a PDA, I carried that book to keep all my notes in and to write things in, and I had volumes and volumes of these steno pads because she was the exemplar, I think, of somebody who was a great leader in child welfare. She's since retired and has done other things, and occasionally we keep in touch, and occasionally on days when I find it pretty difficult, I'll send her an email or say, Rosemary, you didn't tell me about all this stuff after all those years, but she kind of made a big flashback. And I guess as we're trying to kind of pull it together, because as we spend all this time together and we kind of throw all these things at you that are really important things, sometimes I think it's hard to absorb all of that. And it's really hard to kind of think about how do we manage that. And I'm always really interested, as somebody who's interested in education, is how do we transfer that learning to make it real? It could be the greatest meeting, the greatest conference in the world, but if you can't translate it into making it real in your own state for yourself, and for each individual person, that's a very individual thing, I think then it's worthless. And I think that bringing it together helps us to kind of challenge you to think about that transfer of learning and how you can bring that forward. So what I thought might be a good thing to just think of is to kind of just take a look at where we've been for the last couple of days. With listening to music from the Foundation Youth Choir as we began. And I love that little boy who just screamed out his little screams as he was going. how he was very contained by that one older girl until she let him go, and then he just went off and did his thing. But he's perfect because he utilized his strengths to, do his little work, and everybody appreciated and enjoyed him for where he was, which I think was wonderful. Rather than saying, you can't get up there, he was embraced as being unique in his own right. Hearing from CFSR and beyond, Will Hornsby, who is one of the most understated and yet brilliant people in the Children's Bureau, not to take anything away from anybody else, but he is, I think really kind of exemplifies how to make that CFSR process a real process of transformation and not just an exercise. How do you take that and really turn it into something that really can be a transformational experience for children, youth, and families in your own system? And again, unless you do that, it's just an exercise in kind of putting things on paper and getting it ready. But in reality, I think Will really talks about that in such a passionate way that you can really understand that. I have to tell a funny story about Will. I had a new laptop computer a couple years ago, and Will was using it. You know how Will uses a lot of southern isms? And I was way in the back of the room not paying attention. I heard him say, "Gary, this laptop is on fire. No, it's smoking." And I said, "Oh my God, my laptop is on fire." And being a New Yorker, I didn't understand that smoking expression. But Will and I always laugh about that because his passion and his personality kind of lend itself to the work that he does. Chris Sahanchak, who is a phenomenal mentor of mine personally, but also somebody, again, who I think epitomizes leadership in a way that is really exciting. I love her connect the dots metaphor. I love her pumpkin at the end. But more than that, Chris really gets people to think about what is it that we are trying to do in terms of transforming system. Marquita Garner-Gotro, who I've had the great pleasure of working with for 3 years since Katrina. Yeah, it took a hurricane for me to kind of work intensely with Louisiana, but it's been a phenomenal experience. And she has been providing wonderful leadership to people in Louisiana throughout that terrible situation that happened and beyond, and has done a great job with the fabulous staff that she has, many of whom are here. I mean, I've had the great pleasure of spending a lot of time in Louisiana since I live there half the time. But I love the fact that Marquita really can talk with such passion about getting people excited and doing things. And believe me, it's not easy. I see her on days when it's really challenging. And yet she continues to kind of move forward. We had a bunch of workshops, which I stepped into some of them, and they were really exciting and interesting, and I'm not going to tell you about all of them because you went to them, but I think they provided some other information for us to use. Integrating Data to Facilitate System Change by Penny Mazza and our colleague Linda Arnold, I think challenges us to look at data not just as numbers, but how numbers can be useful in changing the way we think about systems. Again, kind of a thing that folks are sometimes scared about. Social workers frequently keep away from numbers, and yet we realize that the outcomes that those numbers produce really can provide some interesting challenges around how we practice. In our second day, which was filled with great things, including the Adopt Us Kids video, which those 3 or 4 great moms really, I love the mom who was talking about the fried chicken, and I told her, and she said, "That was a real story." And I said, "Yeah, I kind of figured that." But you could smell that fried chicken as she was talking about it. And I think the announcement of the National Resource Center for Recruitment and Retention of Foster and Adoptive Families at Adopt Us Kids is a great announcement and a wonderful addition to kind of reframing technical assistance. And it's a great long acronym, longer than NRCFCPPP. Leadership and cultural competence to achieve system and culture change. I don't think there was anyone who did not enjoy Dr. James Mason. I've never heard him speak before, and he was fabulous. I love the fact that he was so inclusive, and you know what I mean. And I think that he also is really somebody who is able to use humor to capture something that sometimes people don't think they can laugh at. And he used himself to also kind of help capture that humor. But again, more importantly, I think what he does is challenge us to look back at our own cultural systems. I think sometimes when we think of a place, where there's not a lot of diversity with respect to race or culture, we think there is no diversity. But even in those systems, there's a huge amount of diversity when you look beyond what we just see, kind of on the surface. And beyond that, I think that he really kind of challenges people in a humorous way, but in a serious way, to think about important issues. Multi-Ethnic Placement Act of 1994 as amended by the Inter-Ethnic Adoption Provision of 1996. And I think I got that wrong. It was Kathleen and another person. Was it Eileen? Eileen, sorry? Okay. I think did a fabulous job of presenting some really challenging information. Information which we sometimes need to help in understanding, information which I sometimes think people struggle with, but I think important information which we can really think about how do you integrate that in the context of your own work. Believe me, I was writing notes and making a lot of noises as I was sitting over here listening because I think it was the first time I've seen it presented in a way that got me to really look at it and still be challenged, but at the same time realize that there's some assistance in helping people to do that. And I think there'll be other assistance forthcoming as well that we can really rely on and look towards as we try to implement the Multi-Ethnic Placement Act. Continuing day two, the awards luncheon, I just want to mention Ellen Carey because I was upset when not that many people knew her, and we got to show that video of her, especially in that wedding dress, which I loved seeing because Ellen Carey was one of the nicest and funniest and most dedicated people in child welfare that you've ever met. And there's this one photo of her in this wedding dress where she's standing there like, I just love it because that's so Ellen. And beyond that, she was somebody who was such an inspiration to so many people and exemplified leadership in a quiet way. She was not up front here. She rarely spoke, except maybe at the beginning of a meeting, but she was very engaged and fully somebody who left us too early and yet was somebody who was indelible in the mark that she left behind, as well as the other award winners who were announced today. We had some more workshops this afternoon, which I thought were interesting as well and covered an array of topics. Federal updates, which thank you, Elizabeth, for providing that information, which I think is everybody's anxious to see where we're going to go, and I'm sure you're anxiously writing it. But I think that that's really an important piece of what people need to know and why the Children's Bureau is so important in interpreting policy for the federal government. And Jane, thank you for plugging the NRCs. And one plug for our NRCs, because I do not want to be hauling back those very heavy books that I brought here and charged on my own credit card to print so we would have them for you all. But there's a bunch of family finding guides there. If you only took one, please take two, because otherwise I'm going to have to carry them back to New York, and they're a really great resource. They are online in color. They're in black and white because it was cheaper to print them that way. But please take them, and if there are other information there that you haven't had a chance to do, please take that as well. Okay. Talking about bringing it on home, I think that this is kind of like the theme here, and I want to mention a few things, and I'm going to ask you to do a little bit of thinking on your own, too, is I think that when we do something like this, what we've tried to do is to model some strength-based approaches to forward thinking, right? Not just looking at what's not going right, but what are some tools that actually are useful for you all to think about when you go home? And I think what happens also, and one of the nice things about conferences is that you have a chance to be away from your everyday work. I know that when you get back, there'll be 300 emails and 500 phone calls, but it's nice to kind of be away from it, so when you return to it, maybe you can be invigorated and recharged. And kind of thinking about tools that you can use are really great. I know when I'm at something, I'm jotting things down, and sometimes I run back home and then look it up online, and sometimes I forget. We want to take a moment to pause here after I stop talking to get you to think about what do you want to go to online, who do you want to call, who do you want to connect with, what do you want to do. You could convene meetings in your own state, and you'll be certainly doing that if you're participating in CFSR in lots of different ways, but there are lots of opportunities to do that as well. I don't know if everybody's as brave as Marquita about giving them out their cell phone number to foster parents, and I think that that's wonderful, but I think that those kinds of things about how do we engage people in our states are really important and useful. Can we use videos? And we've done some of that today, and we wanted to do more. And just, I guess, also on our NRC website, we have these wonderful digital stories, one of which we showed after Marquita's presentation, but they're downloadable for free on the website, and they're really great. I mean, they're great to use as a young person's voice, and there are staff stories, and there's two wonderful stories about women who worked for OCFS in Louisiana who lost their homes to the hurricane and how they recovered and what they did. So there's lots of really great stuff that you can utilize yourself on there to inspire. For training for staff, for foster parents, for adoptive families, I think it's great to do. A lot of our stuff, not on our resource center, but everybody's resource center is archived too. to. So you can literally watch a webcast with your staff that we did on concurrent planning like 5 years ago, which is still current, and you just click on the website and you can use it as what Mary always used to say has a long shelf life, right? If it's archived and it's good and it's on there, you can use it because it has a long shelf life. How do you use your own youth and foster parents and adoptive parents in your state to communicate the message? How can we engage families, engage young people in a meaningful way, not just kind of bring them up here and showcase them, but really engage them so that they can, be integrated into MAP training, integrated into other kinds of training that is kind of threaded throughout the work that we do. What does success look like in your state? Sometimes we all say from big states, oh gosh, if I came from a small state, it'd be so much easier. That's not true. It'd just be different. And I think that folks need to look at what works in their state well, and how can you then help effect that change in a small way and maybe move it towards something larger than that. Without waiting for a hurricane, in other words, leadership in action, which has been the theme of this entire 2 days, is really kind of what we're hoping people will think about. We started with Marquita's story, but in reality, it's not just that will make such a magnificent change in an organization. It's really the leadership that is right there. In your packet, when you were first here, you were given one form that you may have seen, and maybe you were really one of those people who fills out every form. And if you have it and you can see it, it looks like this. It has blue at the top. And if you could just yank it out for a minute, that would be useful, because I'd like you to spend a minute taking a look at it, because it's really what is your personal child welfare leadership in action plan. And if you don't have it, it's okay. You can kind of follow along. But if you got it there, you may want to take a peek at it. John Levesque, I understand, developed this, and Natalie and Natalie's Resource Center. But really thinking about how can you move from the learning to the practice? How can you utilize some of the things that you've done here in these past 2 days to think about what are improvements or strategies or idea. When I looked at this, the first thing I thought of was it looked like a treatment team plan that we do for kids and families, or a service plan review, right? Which actually it would be nice if we could mimic some of the things that we do with families. But I think that idea of, I remember, what's the problem? What's the goal, as evidenced by what? That's what we used to do with treatment planning. But here, it's a little bit more strength-based. Identify an improvement strategy or idea. Did something happen from any of these sessions or any of the workshops or any of the other experiences that we did during the past few days, and hopefully more than one, but at least one thing, that inspired you to think, I want to know more about that. I want to make sure when I go home, I look at that website. I want to make sure when I go home, I email that person to get further information. And those kinds of things. So I'd like you to just pause for a minute and think, is there something that you thought that gave you an idea that caused you to think, I want to jot that down so I don't forget? And even though Rosemary Costello taught me to be what she used to say, to be comfortable with silence, I know that you're all looking forward to leaving, so I'm not going to be silent too long, but hopefully you have something in your mind, right? What are some of the steps that need to be done to kind of make that happen? Does it mean you just got to go online and look for it? Does it mean you got to make a call? Does it mean you have to do something when you go back home? Can you do it here before you leave? What are the responsibilities? Who will help me do this? Because even as we were talking at lunch with folks about very simple plan, nothing's simple. There's always lots of people that are involved in it, right? And once you start thinking about it, and even if it's presented as idealistic and simple, then you think, oh yeah, but we got to involve that one, we got to involve this person, we got to bring this person on board. So who needs to help you do this? Followed by, are there partners or authorities that you need to touch base with? Are there resources that you need? Money, obviously, always. But other resources too. Like, who's going to do it? Right? Don't you love when somebody says, this is a new idea, and you say, well, who's going to do it? Well, you're going to do it. You know, it's one more little task that you have to do, and sometimes you're okay with that because you feel passionate about doing it, but what's the one more thing that somebody needs to do in terms of the resource that you need if it's personnel? And timeline, by when? Like, what's the goal? You know, even at lunch when we were talking about a plan, it was like, well, maybe we could do that by next September. Is that realistic? Well, yeah. You know, it's October now. If we give ourselves 11 months, we could probably pull that off. You know, maybe a little sooner, but that's not so bad. But by when? What are the positive outcomes for children, youth, and your families that will result from this idea? What are some of the things that might be outgrowths of what you're planning? How do you know what your benchmarks are? I'll tell you what we were talking about at lunch. It was like talking about an adoption competency program in a state, engaging that. How do you start that off? You know, what's a benchmark? Well, if you're not doing anything on that at the moment, then you can start with there and then look at it at various points in time. So you can benchmark it in a simple way. And lastly, what are your measures of success? How do you know what you've done works? It's like that treatment team plan, right? As evidenced by what? You know, John will stop wetting the bed. He will be given medication to do that. He will be monitored on a daily basis, as evidenced by how do you look at that? So I think these are the kinds of things that hopefully folks will have an opportunity. You know, maybe some of you are staying for the adoption managers meeting, some of you are staying for the foster care managers meeting, so you'll be here for another 2 days. I'm sure there's lots of opportunities in those 2 meetings to continue some of the dialogue that we started today. Those of you who have to leave us and return back to your jobs and your lives and your homes, well, I'm sure think about this in other ways as well. But hopefully you'll have a chance with the folks that you've come with to take some time to think about the kinds of things that we talked about and how you can put that into action and provide some leadership either with your own staff or just amongst yourselves in the sense of how do you move that forward. A pause for a moment of folks who might be willing to share with everybody. Did something come up for you that you thought, gosh, as a result of being here, I know I want to go home and do that. I know for myself, I want to make sure I get that MIPA presentation so I can put it on my website and put it in weekly update so that other people know about it and other people can generate some talking about that and what that might mean. And then they'll call Natalie's NRC or my NRC or other NRCs to get technical assistance about how to make that happen. I know that as I was listening to that, that kind of triggered something for me, and that's what I know I'll do. What about you? What might some of you think about doing? Yes, okay.
I want to use an implementation center because I want to be not Tolstoy, not implementing just one principle. Because, you know, that's the thing that's frustrating. We keep saying we're going to do things, we need to do things.
Yep.
Yeah, so great. Thank you.
Good. And we'll have them soon, and there'll be lots of other resources that weren't there before. Regional resources. Yeah, what Gay said is that you want to engage the implementation resource centers because it's new money, it's new folks that are doing them, there are new ideas, they're regionally based, you know what state is connected to what implementation center, and you can make use of those resources and not have to reinvent the same idea over and over again. Other folks, I saw some other hands there. Yeah, Deborah.
I feed myself to the ideas that Sally and I were we like bridging the gap.
Good.
We really felt that was doable, following a small region in Texas and working with our providers and our staff and really working that model because it felt very doable and great information.
And bridging the gap was birth and foster parents?
Birth and foster parents working hand in hand. And then the second was that we needed to get with Louisiana to find out what they're doing, how they moved so many youth out of residential treatment centers and getting them into least restrictive placements. So those are our 2 priorities that we're taking away.
Great ideas. And one of the things that I went up to those folks who did the Bridging the Gap thing and said, would you be willing to do a webcast for us and come to New York and do that so we could broadcast what you're talking about? And so we hope we'll do that soon so we can make good use of it. Right. And the other idea was, how do you bring that number down of residential youth in residential placements like Louisiana did? And that's very doable and very possible. And there'll be great folks, Joe Bruno and Joel McLean, to talk to about those things. Sean?
Yeah, I was really struck by some of Penny's data, which I'm always struck by the data. But one that really stood out for me was the reason for custody for re-entrance. And one of the things that I can do very easily on Friday is pull our data and see how it compares to what Penny's data was showing. And then that will dictate some other things. But that just really jumped out.
Great.
I think it was 24% kids.
Right.
Reasons for re-entry was child behavior.
Right, that's wonderful. Using your own data to look at things that Penny used on a national basis to kind of spur some other ideas and thoughts for your own state. Great. It's wonderful. Yeah, Mike?
I think it's fascinating what Washington State's doing with Adopt U.S. Kids. They're using market segmentation to their diligent recruitment. And it's all this data that's out there that these corporations collect on you. Like when you go to the store and they ask for your zip code. Well,
Right.
They know that you bought dog food and a six-pack of Coke that day. So it's taking all that data and using it to recruit foster and adoptive parents. It's really fascinating.
Great. And we need to think around some of those strategies and how it can help us do the work that we're needing to do. Great. So you're going to implement that all over Kentucky, right?
Immediately.
Immediately. Good. Who else? Okay. Oh, Marquita.
I've got 3, but I'm afraid my staff will kill me if I add
What's 3? You've done 100.
I love the Bridging the Gap. That was so powerful, and I'm very excited about trying to see how fast we can jump into that work. And transitioning youth, I've already made a couple of contacts with Texas and Massachusetts. It's going to help us with the next step, and so we're real excited about that. And I'm with you about the implementation center. If there's anybody out there that we hadn't tapped in, we're going to find them. So we're on to that too.
Great. Great. Thank you, Marquita. Please make sure before you leave that you turn in your evaluations. Those are really important for us for future conferences that we plan and future opportunities. Want to send a huge, huge, gigantic thank you to Natalie Lyons and Ingrid Park. Our colleagues at the National Child Welfare Research Center for Adoption Services. They do a fabulous job at Spalding, and they're great colleagues to work with. And to thank Heidi, who was shepherding us along on all those teleconference calls. There were many, many of them. And for the entire planning committee that worked along with us, and for the Children's Bureau staff who provide wonderful leadership along the way, we really appreciate that, especially to Jane, who does a great job in capacity building. Thank you. We appreciate that. And thank you all for being here, for the great work that you do, for spending the time that you have spent with us these past couple of days, and for the time that you'll spend in the next couple of days if you stay in for the other meetings, and have safe travels home. We hope to see you again soon. Thank you.